Okay, welcome. This video will be taking a look at eligibility and access to care as part of the Unit 2 for BTEC Health and Social Care. So the first thing to think about when it comes to accessing care is how people get referred to health and social care organisations. And normally referrals come in three ways. A self-referral is when the person will contact a care provider, whether that's a letter, phone, email, make an appointment, but they contact them directly. And normally these are primary care settings, so your GP, dentist, optician. A third-party referral might be a friend or a relative contacting a health or social care service on someone's behalf. It might be a referral through a charity or some kind of organisation, again, trying to get some support in place for an individual. And finally, professional referrals. Normally these come from professional contacts and they're getting support for a user from different aspects. So this might be a GP, for example, your primary care, contacting a secondary or tertiary sector of care to provide that support. It could be a charity passing information on to someone else. So again, we have these different levels of care. Now, when it comes to accessibility for care, so if someone's been referred to a system for care, obviously local authorities will need to make an assessment, and they'll do what we call a community care assessment. So if someone has difficulties looking after themselves or needs a bit of additional support, this is where these agencies will make an assessment. And normally it'll be sort of adult social care services will do that. And when they do this, they will consider lots of different elements of that person's life. So, the needs they have and the impact it has on their care, the choices and goals of the individual. So particularly elements of empowerment here, trying to empower someone and considering their goals and choices. What they need help with, whether it's getting dressed, washed, preparing meals, the types of service and information they have access to already, the resources they already have, and what could be provided to prevent issues developing. The needs of the family, and also impacts of cost and provision. So this is what will be assessed, this will be reviewed. And then they'll look at eligibility criteria. Is this person eligible for care? Now, there are three elements to eligibility. So it might be, does their need come from a physical or mental impairment or illness? Is it something that they need help with to meet a specific outcome or goal? And obviously the impact or the issue has a significant effect on their well-being. Now, those specified outcomes that I mentioned here, these are the eligibility criteria, the specified outcomes, the things that need to be assessed. So these are very much things you'd expect. Can someone prepare food? Can they wash themselves? Can they go to the toilet, dress themselves? Can they move around their home? Can they clean their home? Can they get access to training? So if an individual has any three of these particular outcomes affected by their impairment or their illness or whatever it would be, then they would be eligible for care. And then obviously what would happen is that assessment team would determine what type of care has been needed, how it's going to be funded, how it's going to be provided, and how it's going to help them to achieve their goals. Now, while we've looked at referrals, what's really important here is to consider the barriers, the things that prevent access to care. Most questions will ask about barriers, and we'll come back to that in a little bit. So barriers can be things that kind of physically or somehow prevent somebody accessing a healthcare service, and there are lots of different types of barrier. So you might find specific need barriers where the individual, the specific characteristics, the needs, the traits of that person make it difficult for them to access care. Now, that could be linked to learning difficulties or physical disabilities or impairments. It could be mental health related. It could be the individual's age, whether they're older, younger, again, making it difficult for them to engage with or access care. They may have a refugee status, which again limits their care options. You might find that someone who's transitioning from one sex to another will find it very difficult to access care, particularly with things like waiting lists presenting barriers to care. Individual needs, on the other hand, are slightly different. These are more about individual preferences and choices. So it could be that someone's religious values or cultural beliefs will prevent them using certain medication. They may exercise their rights. They want to be treated at this place or in their home or in a particular way. You might find preferences where women may prefer to receive care from another woman or man for another man. You might find people who have terminal illnesses who don't want to travel for care, and people who may not be able to make decisions for themselves obviously need someone to make that decision for them. So these would be like individual needs that can again create a barrier. Now the main barriers I talk about something called crisp gated. Put all these barriers up here for you to see. So we've got crisp gated. These are the key barriers that I feel affect most people. So communication barriers would be things like English as a second language, having a speech issue, or lack of an advocate or a translator available to help you get to appointments. Religious barriers might be, as we mentioned, with individual needs, the religion you hold preventing medication or interaction with a professional as a result of their gender. Individual preferences, again, you want to be treated at home, or you want to have a type of care that isn't easily deliverable, and that can prevent and create delays in accessing care. Specific needs, again, the person's age, gender transitioning. It could be things like a single parent having difficulty getting access to care because they have children and have no one to look after them. Physical barriers and sensory barriers. So this is generally linked with section sort of 2 in that exam. Or section 3. So someone with a physical or sensory impairment, and again that links to access arrangements, awareness, maybe fear of discrimination. Geographical barriers is the availability of services in their area, so the postcode lottery effect. Awareness barriers is not knowing what support is on offer. Transport barriers can be linked to geographical, so if you don't have the services in your area, you're going to have to travel, and that can create a barrier. So whether you don't have a car, you don't have the means to travel, whether you're unable to use public transport, again, whether you have an impairment that prevents you easily travelling, these would be the transport barriers that you can connect to geographical. Economic barriers, financial barriers, again, you can tie them to transport, paying for the cost of transport, or paying for treatment to be delivered privately, or even if it's not private treatment, but you're paying for some additional carers, supporters. And lastly, discrimination. This is the emotional barrier. So again, fear of discrimination, stigma, prejudice as a result of a health condition, mental health condition, a person's circumstances. So for example, I know I mentioned discrimination in terms of physical and sensory abilities, but you might have someone who, again, single parent, may feel that they might be judged or discriminated as a result of those circumstances. And just to round off, again, barriers I think is a really, really important area of this exam to make sure you have taken a look at. As I've got 5 examples here, barrier questions come up a lot. There have been 13 questions on barriers across 10 exam papers. So, there's at least 1 question on barriers on every paper, sometimes more than 1. And they come up in all areas. So you have 2 markers here, you've got some 4 markers, you've got 6 and 8 mark questions, all on barriers, preventing access to care. My advice when it comes to a barriers question, the key things to do, obviously identify the type of barrier. That's the one thing you'll do. For a 2 marker, you just identifying it, but for later questions, you need to add a bit more detail to it. When you're identifying the barriers that affect the person, try to make it specific. Try to reference them. So if it is a 6 marker, saying barriers that would, explain potential barriers that would affect Jessica's access to health, try and link it to Jessica. Jessica has this issue, this creates this barrier, this would mean it would be difficult for her to access care because. So do try and make sure you are explaining, as the question asks, those points, again with discussion questions. What's the barrier? How is that going to affect them? How is that going to affect their ongoing care? So do make sure you read those questions and you're connecting the dots. But as I say, The exam board, they love questions on barriers in the same way they love questions on multidisciplinary teams and people in later adulthood with dementia or Parkinson's. It's one of those common themes. It comes up very, very frequently, and it's one of those areas that I strongly recommend that you revise. Okay, as always, thank you for watching. I hope this has been some help, giving you a bit of guidance, a bit of feedback there. As always, like, subscribe, tell your friends, all those good things, and that's great. Thanks for watching.